Patients, the intern pharmacists, and everybody present here today. Good morning. So today's presentation is a continuation of our presentation last week Thursday, which was initiated by our dear pharmacist here, Pharmacist Joy, and we can all agree that she made justice to her own part of presentation. So my name is Pharmacist Kuwa Ahemba Victor, and today I'll be taking the blood urea nitrogen test and the creatinine blood test. So blood urea nitrogen test is the test that measures the amount of urea nitrogen in the blood. So urea nitrogen is a waste product produced when the body breaks down protein. And then when this waste product is produced, it's being carried in the blood to the kidney to be eliminated out of the body. So if the kidney have some issues, the elimination becomes an issue also, and then ends up with excessive accumulation of urea nitrogen in the blood, which leads to some other health challenges like high blood pressure, anemia, and heart diseases. Next slide. So blood urea nitrogen test is a test that helps with the diagnosis and monitoring of kidney diseases. It is also used as a screening test for people who are at risk of developing these kidney diseases. Next slide. All right, so it's not all the times that when one do blood urea nitrogen test and has high values means that that person is down already with kidney diseases. There are other factors like dehydration can also make the body have excessive urea nitrogen. So when one is dehydrated, the body secretes a hormone called antidiuretic hormone ADH, which decrease urine flow rate and increase reabsorption of urea to contain the available fluid in the body. Then burns triggers hypermetabolic responses leading to rapid breakdown of protein and then ureagenesis. Ureagenesis is the process in which the body produces urea, and part of the ureas that you have in the body that are being produced in the liver through the process called this ureagenesis. Then we have high protein diet. I said earlier that urea nitrogen is produced when the body breaks down protein. So increase in protein in the diet will lead to the breakdown of more protein and release of more urea. Then certain antibiotics like tetracyclines, e.g. we have doxycycline, vancomycin, and then some cephalosporins and aminoglycosides may also contribute to this because there are still studies ongoing to confirm that this actually do this. Then sometimes we may have high blood urea nitrogen test and test results, and then sometimes we may have low blood urea nitrogen test results value. And then these are some of the factors that could attribute to this. We have lack of protein in the diet. If you can go back, I said earlier that this urea nitrogen is produced when the body breaks down protein. So if you're having lower amount of protein in your diet, then you have lower amount of protein to be broken down and lower amount of urea to be produced as waste product. Then we have malnutrition, we have liver diseases. So I said earlier that ureagenesis is being carried out in the liver, which is a process in which urea is produced. So if the liver has some issues, you may have low amount of urea in the blood. So you can also indirectly say that maybe you can use that to also query or suspect a liver disease, but there are some other tests you can do that to confirm that, like liver function test and some other ones that was taken by our colleague here, Joy. Then the results. So in the United States of America, the BUN test is being measured in milligram per deciliter. Then in millimole per liter internationally. Then the normal range for this results is between 6 to 24 milligram per deciliter. Then if you convert that to millimole, you have 2.1 to 8.5 millimole per liter. So it's Mayo Clinic. All right, so we'll go down to creatinine blood test. So creatinine blood test. Okay, so the blood urea nitrogen test has to do with the measurement of the amount of waste product in the body. Likewise, the creatinine. But in creatinine, what is measured is in creatinine blood test, what is measured is the creatinine, which is also a waste product produced when the body breaks down creatine. And creatine is part of the muscle. Then when this creatinine is produced, it is also carried in the blood to the kidney to be eliminated out of the body. So if the kidney have issues, you also end up with excessive creatinine in the blood. And creatinine blood test is also used to assess the kidney functions. Then we can also have high creatinine in the blood, which may be attributed to other factors like consuming large amount of cooked meat or other protein sources, consuming creatine supplements, like the body, people who build their body, they take supplements, this kind of supplements to enhance their body building. And when you take a sample from such an individual, you discover that the person may have a high amount of creatinine in their blood. Then we have dehydration. So you need more fluid to flush out creatinine. Then muscle disorder, rhabdomyolysis, which is the rapid breakdown of muscle tissues. Then you can also have low creatinine in the blood, which can also be attributed to these factors, which low protein diet, hydration, fiber-rich diet, and low muscle mass. All right, so the results, there is a range, and this creatinine blood test is measured in milligram per deciliter. Then we have the range, the normal range for the male, and then we also have the normal range for the female. So for male, we have 0.9 to 1.3 milligram per deciliter, and then for the female, we have the normal range of 0.6 to 1.1 milligram per deciliter. So blood urea nitrogen test and creatinine blood tests, they are all tests for assessing the kidney, and is also advised that people who are at risk of kidney diseases should always go for routine blood urea nitrogen test. Thank you for listening. I will now take a bow for my colleague to continue.